as a speech-language pathologist, we work on language disorders with both pediatric and adult populations, from strokes such as aphasia. We'll work with cognitive issues related to memory, processing, and reasoning. We also work with voice patients who may have issues with their singing voice or even their speaking voice. Probably 80% of our job is working with patients who have issues swallowing. So we really cover a wide variety of health issues related to cognition, memory, and language. Aphasia is probably one of the biggest areas of difficulty we'll see with patients. Stroke patients will a lot of times have issues with both their expressive communication, to be able to understand language and follow directions, and probably right along with that is an issue with swallowing, where patients may have trouble chewing food, safely swallowing food. So aphasia and dysphagia, that issue swallowing, are probably two of the biggest things. We really want to do early intervention and redeveloping those pathways, and the big buzzword with that is brain plasticity or neuroplasticity, where you're stimulating the brain as much as possible so that other areas of the brain take over for the part that has been damaged. One of the biggest issues with having swallowing problems is the risk of aspiration, which could eventually lead to an aspiration pneumonia. So as a speech pathologist, we would look at how well you're sensing that food that's in your mouth, how strong those muscles are to be able to manipulate that food, and then we assess that risk for aspiration. Allow yourself some grace, because it's a huge transition to see your spouse or your parent going through such a change where they lose a lot of independence and autonomy. I think the second part of that is, don't be afraid to ask questions to any member of your rehab team. That's what we're here for, to empower you and to give you as much information as we can. This process of recovery is lengthy and it's not easy. They'll have good days and bad days, as will you, and we'll help you through those days as well.